Next speaker today this next one is Indigenizing Health Research Ethics in British Columbia, how to co-create wise practices and distinctions-based ethical protocols in Indigenous health research with Dr. Krista Stelkia. And Dr. Krista Stelkia is an assistant professor in the Faculty of Health Sciences at Simon Fraser University, director of the Centre for Collaborative Action on Indigenous Health Governance, principal applicant for the BC Network Environment for Indigenous Health Research, or BC NEIHR. Krista is Silks Tinglet from the Osoyoos Indian Band in the interior of British Columbia, Canada. Dr. Stelkia is an interdisciplinary Indigenous health researcher whose research primarily investigates the structural determinants of Indigenous people's health and well-being. With a background in health sciences and criminology, Dr. Stelkia's research has critically explored structural racism in health, indigenizing health and wellness indicators in public health reporting, Indigenous health mentorship, connection to land as a determinant of health, and police oversight and accountability. Dr. Stelkia has over 15 years of professional experience working with First Nations communities and organizations, including the Office of the Chief Medical Officer at the First Nations Health Authority. She joined the Faculty of Health Sciences as an assistant professor in September 2022. And now I'd like to turn it over to Krista.
Good morning, and thank you, Terri, for the overview. It's really lovely to be here, and thank you to the presenters before for your beautiful photos. I will preface, I don't have a lot of beautiful photos, but I will try to entertain you with a lot of really great information. But it's really wonderful to be here. So I just want to first acknowledge the territory on which we're gathering on today, which is the traditional territory of the Musqueam, Squamish, and Tsleil-Waututh peoples. As mentioned in the bio, I'm Silk and Tlingit from Osoyoos in the interior region, and as an uninvited guest, I'd just like to acknowledge the lands on which we're gathering on today. So I want to start with a bit of background for the importance of this type of study. So ethical standards and guidelines play a foundational role when it comes to overseeing ethical research with patient partners, with Indigenous communities, or any types of tri-funded council research work. And so while ethical frameworks often take a pan-Indigenous approach and are overarching and often take a one-size-fits-all approach to ethical engagement with Indigenous communities, there's a real need to start to foster more collaboration and more nuanced understanding of how to engage with distinct communities. So in the province of BC and even across Canada, there's been a shift and movement towards a distinctions-based approach, which means that we need to be able to have a specific designation and understanding of the constitutional rights of each of the unique Indigenous groups, including First Nations, Métis, and Inuit, as well as within respecting the distinct nations overall. So in BC, for example, we have over 203 First Nations communities. Each has distinct rights, values, and different stages of the ethical process. And so this creates a really complex way of how do we engage with distinct nations, making sure that we're able to adapt ethical frameworks to really fit the research process. And so as part of this work, through my role at the BC NEIHR, we conducted an environmental scan of current ethical processes for Indigenous health research in the province of BC. This was a collaboration between BC NEIHR and also Michael Smith Health Research BC, FNHA, and UBC. And so through this work of looking at what are some of the existing ethical frameworks, we engaged in semi-structured interviews and sharing circles with research ethics boards within the province of BC. So through this engagement, we engaged with 21 out of 27 rep boards. And then we also conducted 3 sharing circles at universities with Indigenous faculty, Indigenous students, and Indigenous communities. And so through that engagement, what we heard was that many research ethics boards, when reviewing Indigenous health research applications, are still unaware of certain distinctions-based guidelines. Some REBs lacked confidence in adequately reviewing Indigenous health research submissions due to limited training, staff, and also capacity and expertise. So many of these REB boards, they sit within universities, and because of the lack of Indigenous scholars in university settings, there's a gap in knowledge in terms of how to adequately assess these types of applications. So in terms of what we heard, we did see a disconnect between the knowledge that REB holds and also how communities perceive their applications when submitting them. And also, Indigenous health researchers reported that they remain hesitant or sometimes fearful to engage with REBs when they have community-based research for fear of different types of amendments or provos that may come. So this represented a gap in the current literature, and as good researchers, we thought, let's investigate further. So in response to the environmental scan, we submitted a 3-year CHR project grant to focus on improving and advancing Indigenous health research ethics, practices, and protocols in BC to be more culturally safe and grounded in Indigenous knowledge systems and distinctions-based guidelines. So through this project, we have a number of incredible team members representing provincial-wide organizations really invested towards transforming ethical research. So we have representation from the First Nations Health Authority, Métis Nation BC, BC NEIHR, the Faculty of Health Sciences, Research Ethics BC as well, and this project is generously co-funded by CHR and also Health Research BC. So in terms of the project, it's 3 main areas, which I'll go into a bit later. But the first was to conduct a scoping review on what were some of the current ethical guidelines and protocols available when it comes to reviewing research ethics applications in the field of Indigenous health research. The second was to explore what are some of the gaps, challenges, and barriers that researchers and communities are facing when submitting applications to ethics boards. And then the third was to facilitate a co-creation convening space where we would invite participants to review some of the gaps and challenges that were identified to be able to co-create innovative solutions to address those. So this is my fantastic team that's based at the Center for Collaborative Action that's helping to mobilize a lot of this work. So I have some of my PhD trainees and also my research assistants, many who are Indigenous trainees or scholars as well. And so through this process, we're able to not only train and conduct the research, but also to support their academic learning journeys as well. So I'll just briefly go over some of the methods for this particular project. So phase 1 is we conducted a national scoping review on Indigenous health research ethics guidelines, protocols, and frameworks. Some of the more familiar ones, like Tribe Council Policy Statement 2, Chapter 9, are national. However, there are very distinction nation-based guidelines that will be picked up through this review. So there was 2 primary questions. What are the ethical guidelines, protocols, and frameworks used in Indigenous health research in Canada? And then secondary questions explored how are these supporting a distinctions-based approach? And what are some of the gaps and challenges being experienced in applying ethical frameworks guidelines when used? So this is really exploring from researchers and communities, how are they having challenges and barriers in applying these ethical frameworks? So the second phase is that we are conducting 170 semi-structured interviews with Indigenous communities, research ethics board members, and also Indigenous health researchers, including trainees in the province of BC. So happy to report that we have half of our sample so far, and we're moving forward with the next iteration. But this interview process will really help to explore what have been people's experiences in applying to research ethics boards. And this will also look at behavioral research, clinical research, and patient-oriented research, and also looking at the application of distinctions-based protocols that do exist. So if you know anyone who's interested and passionate about talking about Indigenous health research ethics, here are 2 of our recruitment flyers. We're currently recruiting Indigenous communities who have worked with researchers to submit applications at REBs. We also are looking for REB members. I know REB members often rotate every year, so if you know anyone who's interested in sharing their experiences, we would love to hear from you. And I also have a QR code at the end as well in case anyone wants to scan that. And then the third part, which I think is actually the most exciting part, is that once we have an idea of what the interviews have said about what are the gaps, barriers, and challenges, we will be writing a preliminary report, which we'll be sharing to all participants. And then we'll be inviting all participants to a co-creation gathering where we're able to discuss how to co-create solutions, what are some types of interventions or pathways that we can use to be able to address some of these. And the great thing about the co-creation gathering is it'll include also policymakers, university administrators, communities, trainees. So a really co-creation process. And these are the things that we've been finding. How could we go about in a way? And then from that, being able to identify a number of outputs. So in terms of outputs, so we have the National Scoping Review, which will be published later this year. And then we also will have a final report on interview findings and co-creation, which outlines some recommendations for systems transformation to advance Indigenous health research ethics. And so in terms of impact, this will help to contribute new knowledge for distinctions-based approaches to Indigenous health research. Distinctions-based is still like a new and emerging concept, so this will really help to understand how we can be flexible and nimble in the ethics process. It will also provide information to university rep boards to adequately assess from a community perspective ethical research with communities. And then also it'll help to support the self-determination of Indigenous communities, collectives, and organizations in research by supporting community-led distinctions-based protocols that reps can then take up. So I think that in conclusion, ethical protocols and practices are a bit dated, so to say. Tri-Council Policy Statement 2, Chapter 9 hasn't been updated for almost 15 years. And so this research will really help to understand what are the most progressive ways that we can implement distinctions-based within these overarching frameworks. And the end result is that this will help to support more culturally safe and community-engaged research with Indigenous communities. So thank you very much. And if you're interested in learning more about the study, this QR code will take you to our website. But thank you for being here.
Thank you very much, Krista. We're going to go to questions now, but I'm going to use facilitator privilege and ask the first question. So when you were doing your national scan, how did BC rank when you were looking at how everybody else is doing with indigenizing research ethics across Canada?
Yes. So I found BC to be quite progressive, but when we actually looked at like the distinct, like First Nations, Métis, and Inuit ethical frameworks are really leading the way. And so there's been a lot of progressive work up in the north that I think that we can leverage and use best practices from here in BC. Yeah.
Wonderful. Thank you. And now on to other people's questions. Sorry. We'll go here first because it's closest.
Thank you, Darren Lauser, and thank you for your amazing presentation. I was just wondering, as the surveys are coming in, if you are seeing people talk about the universities being the roadblock from the perspective of publish or perish, and we have a funding timeline. Because when we work with our nations across the province, they don't work on the same timeline. Mm-hmm. And I've been on projects where we've lost PIs because publish, perish.
Mm-hmm. No, absolutely. Thank you for the question. And yes, like we've been hearing through the interviews that the timing within the academic framework, even for example, grants, we have 3 years. That's a lot to do engagement. You know, you do need to have preemptive work. And so we've seen a lot of, like what we've been hearing from the interviews is a lot of researchers will apply for engagement funds first to conduct that engagement and then move forward. But community time is its own time in itself. And so I've seen a lot of stress from researchers, and we're hearing from the data as well, early career researchers in particular being really impacted by the need to demonstrate impact through usually, which is Western frameworks of like publishing, grants, And so there's a lot of tensions that exist. It really depends on the institute. There's some institutes who have been very progressive in recognizing Indigenous knowledge and worldviews and scholarship as an approach, but some which are not. So definitely it is like one of major barriers in terms of trying to ensure like a more holistic, culturally safe process for not only community, but also the researchers.
Hi, thank you very much for that presentation. This is really promising, and I appreciate the way you've kind of acknowledged that this, in BC in particular, we're very progressive with the distinctions-based approach. And I'm actually curious if this has already gained attention in the international scene, because there's a lot of things going on, especially when it involves like clinical trials, harmonizing it with other protocols around the world. And it brings back this memory of, the debate, a very long time debate in research ethics, especially theory of research ethics, between principles-based approach and the so-called contextual approach. And I guess this is coming from that kind of contextual bottom-up approach that respects culture. So I'm curious, has there been like dialogue around the world among different Indigenous communities where a distinctions-based approach would be appropriate, I guess, in research ethics in those different areas?
Mm-hmm. Thank you so much for that question. There's a lot of progressive work that's coming out of Australia. So through some of my editorial work, I have the opportunity to collaborate with a lot of Indigenous scholars in Australia, and they have some amazing work that's coming out, but they're at the same point as us in the sense that they're still trying to push forward for distinctions-based. But I think the context it really matters. In Canada, we just have, over 600 First Nations communities alone, never mind Métis and Inuit. And so we have to be able, through these discussions at a national level, be able to have more nimble policy in the sense that we have these like overarching frameworks, which is Tri-Council, but there are nuanced opportunities at the community level. And even thinking about at the community level, some communities have ethical frameworks, especially in BC. We have some very progressive First Nations communities who have developed really robust ethical frameworks for engaging with researchers. And then we have communities that don't have any. And then we have in the middle this big gray area of people who want to be able to, but not. And so I think it creates like a complex situation where we're trying to adhere to the self-determination of communities first, but making sure that there are frameworks that explicitly mention that and that support that. But I would say Canada in particular is really leading the way for distinctions-based at an international level.
Thank you so much, Krista. Really wonderful work and really important work. So I just want to say thank you for taking this forward. Two comments. One was like, wow, like this is an enormous qualitative piece of research. 170, is it 170
Yes.
interviews? That's going to be a very rich data set, so thank you for that. The second piece is the research approvals process project that's happening in British Columbia at the moment obviously is partly about centralizing and getting consistency across the province on approvals, including research ethics. So is there an Indigenous voice at that table, and are you connected to that work?
So I'm not directly connected, and I know that the field of like indigenizing or centralizing ethics is ongoing. So I try sometimes as a good researcher to have like a little bit of a box around my project because I feel like the scope can get so large. But I can imagine through some of our more recent interviews that we have like data that of people's experiences going through the centralized process. But I can imagine in the centralized process that we have large voices like the First Nations Health Authority, who would also be a really good advocate for First Nations in that space.
Do we have any more questions? Oh, yes.
Chad Dickey from Victoria. Thank you very much for your very important work. My question is around sharing of information, consent. Because one of the big things I understand and I believe is that First Nations, and we want to share whatever we have, personal information, but because of the Privacy Act, Section 59, I think, of the Privacy Act, I think that has to be updated, or it should be updated. Are you, as an organization, involved in any of that, the updating of Section 59, the Privacy Act, or is that something that you may have a challenge with as you go forward with establishing a framework?
Yeah, no, absolutely. Thank you for the question. So I'm hoping that this research will help to inform recommendations for changes like that. And so at the end, through the co-creation process, I'm hoping to have like multiple different outputs, including like a calls to action for universities, government, research ethics boards, like very specific catered recommendations on these are the things that need to be adapted and changed, so that we can get all our health systems partners together to make these changes collectively and collaboratively.
Do we have any more questions for Krista? Taking a note from Sterling, being easy with the silence. Give us a second. No? Okay. Thank you very much, Krista.
Yes.
Fantastic speech. Thank you. That takes us to the end of this segment. So you're invited to, make use of the break time, and the next segment starts at 11:30. Yep. See you back here.